Welcome to today's Washington Healthcare Facilities Community of Practice webinar. My name is Ryan Kronk. I'm with the Water Institute at UNC. And along with our team here, we are the Secretariat for the Community of Practice. And we're really excited to have you on today for the launch of the Safe Management of Pharmaceutical Waste from Healthcare Facilities Global Best Practices document from the World Health Organization. If you have not read it, we will add a link to in the chat. But we're really excited to have experts presenting on the summary findings from the report, and also several countries and partners who will offer some reflections on the report. So just a few quick housekeeping items. We do have several upcoming community of practice sessions. Please stay tuned to the email listserv for updates. We have one on an evidence map for Washington environmental health and healthcare facilities. We have several other topics in the works on cleaning and Washington healthcare facilities in fragile contexts. And we're also always open to suggestions for new webinars. If you have other topics you'd love to see, please feel free to drop those in the chat. Or send me an email, and I will add that to the chat as well once we get started and I'm not presenting. Also, you may have seen we've had some feature projects listed in the newsletter recently. We would love to feature your project if you have something. The way we do this is we highlight a specific project, success story, or learning from our community of practice members and other organizations working in Washington healthcare facilities. So we would love to cast a wide net. I know many folks are WASH folks, and I'm glad that we have a waste management webinar to bring in additional folks into the fold. So if you have any questions, again, or potential stories you'd like to share, you can either drop those in the chat or you can email Darcy Anderson with your ideas. I'd also like to remind everyone that this session is being recorded. I know we just heard before we started, our colleagues in Australia are asleep and they are very keen to see this webinar. We apologize that we can't hit all of the time zones, but we do record these and put these on the YouTube channel, the Washington Healthcare Facilities YouTube channel. And so all of our webinars are posted there. You can view any of the archives. They have transcripts, and we're working on some new AI features to better summarize the content and including language translation. So please, if you have not joined us for previous webinars, please check out the YouTube channel and see some of our previous sessions. So our agenda for today, first up, we're going to have an overview presentation of the new WHO report from Dr. Ute Piper. If you have questions for her, please post them in the chat. We will have a Q&A. We've reserved some time at the end for Q&A for the report, but we're going to jump straight from her presentation into a discussion with panelists. We have several folks from the field and reflections from countries and various partners. And so we're really excited to hear from them on some of the implications of this report for their work and opportunities that exist and challenges. And then we will close with Q&A. So if you have questions, please feel free to drop those in the chat and we will open it up at the end. So with that, I'm going to switch over to Dr. Piper's presentation. All right, take it away.
Okay, here we are. So thank you very much, Ryan, for this introduction. I'm quite excited to have this document launched now. We had worked on it for more than 1 year, and I think it evolved as a very nice and comprehensive document. Next one. But before I'm going into this document, I just would like to interlink the work on this pharmaceutical waste into the global work on WASH and waste in healthcare facilities. So like you can see here, so the countries are committed to strengthen policies and increase investments. So the World Health Assembly resolutions from 2019 and 2023 articulates actions for governments to improve WASH and waste management. And the most recent IPC action plan on monitoring framework is also including waste into their work. So you can see that waste is kind of interlinked in different areas, and I think it's getting more and more knowledge and commitment that waste is part of the whole system. And based on the World Health Assembly resolutions, also WHO and UNICEF together, they set up the joint monitoring program services, the country tracker, the global progress report, and the WashFit, which is already implemented in more than 70 countries. So it's a very successful tool, which is also including waste management. So also the global community engaged and is supportive. So there's a really strong global strategic network. So this is why also this global framework for action has been issued for the framework of 2024 to 2030, with the vision all health facilities have safe, sustainable, and inclusive water, sanitation, hygiene, and healthcare waste management, and reliable electricity for quality care. Okay, next one. So now we start to kind of deep dive into, or not deep dive, but just to have an overview of the document, which you can download and just read through later on. So the purpose is, first of all, to summarize the existing guidance on safe management of pharmaceutical waste. This document is not only focusing on emergency, but also on non-emergency situations, so routine processes as well. So this is kind of the difference of the other pharmaceutical waste document, which has been developed by WHO in 1999, which is focusing mainly on emergencies. So here we emphasize on prevention, minimization, as well as optimal and interim treatment options. And it is including 16 case studies, which is illustrating how to do things, and with pictures and examples from different countries. Next one. So here we have the scope, so what is included and what is not included. So we included the unused pharmaceuticals, the unsealed pharmaceutical products, bulk and loose tablets and capsules, and the cold chain damaged pharmaceuticals. So we are really focusing on the healthcare sector. So pharmaceutical waste generated from households, manufacturing facilities, veterinary pharmaceuticals used for aquaculture, companion animals, and livestock are beyond the scope of this document. I think this is very important because there are other documents which are under development as well, which are focusing more on other sectors. Next one. So here again, you can see the chart on the right. So when we talk about healthcare waste management, most of the waste we are talking about is general non-hazardous waste. And the other percentages are hazardous waste, and only 3% is considered as pharmaceutical and chemical waste. So we are talking really about a very small proportion of the waste generated in a hospital, but still an important part of the hazardous waste. So this is embedded, so this document is embedded in the network of different guidances and related documents. So we have the main guidance, which I hope most of you will know, the Blue Bible, so the safe management of healthcare waste in health settings. It's the main guidance, then some products which are coming out of it, so the summary of the document and the treatment technologies, and of course also the WashFit implementation tool. And then we have the emergency-related one, which I've talked about before. It's also pharmaceutical waste. It's from 1999. It's quite old, but still valid. And then we have the procurement-related documents, and now this one is just fitting into the set of documents. Next one. So for who is this document developed? So first of all, it's for health authorities, but also especially for the health facility staff trained to use pharmaceuticals and manage pharmaceutical waste. So really for the health settings. Then we have also the target audience from the authorities who are responsible for pharmaceutical waste management within the Ministry of Health, the National Regulation Authority, the Food and Drug Administration, regional or local health authorities, or the Ministry of Environment. And of course, when we talk about the transport outside of the facilities and the treatment and final disposal, again, here the relevant authorities and the police is important for this document. Next one. So then we have to put all the activities into a legal framework. So here we have the global framework, all the different conventions, the Basel, Stockholm, the Labor Organization Chemicals, the Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances, or the United Nations recommendations on transport, and of course the 5 guiding principles, the polluter pays, precautionary, duty of care, proximity, and prior informed consent, which are the international guiding principles for all waste kinds generated worldwide. Then we have the key policy requirements, so that we are really asking the countries to have their own legal framework, which is including the reduction, training, PPE, packaging, waste handling, treatment, disposal, and controlled substances. Also in this document, we are really highlighting the extended producer responsibility, as this is implemented more and more worldwide, and this is also a good possibility to reduce the burden of the countries. Next one. So as I mentioned, we really focus a lot on waste prevention and minimization. So not to generate the waste is the first aim of all of us. And so here we have different possibilities. So we can optimize the process by rational use, for example, by better procurement, etc. To have appropriate donations so that we have national guidelines for drug donations. That we are cooperating and communicating with the international partners better to reduce the waste from donations as well. Also, the emergency preparedness and response is one part of this document, and of course the cost considerations. Next one. So these are the elements of the documents when we talk about the pharmaceutical waste management, starting with the management and administration, classification, segregation, storage, safe treatment and disposal, and if necessary, optional, also the external collection and transport. So when we talk about the management and administration, it is really important to have the routine inventory of pharmaceutical waste. So we have also a register template in the annex to pinpoint and clarify clear responsibilities, who is responsible for what in the facilities, but also outside from the authority parts, and also during transport and disposal later on. An important part is always the controlled substances, which need to be considered extra, like narcotics, for example. So this is also hazardous waste, but needs additional safety requirements. Next one. So here we have the classification scheme. So we have the non-hazardous pharmaceutical waste, and we have the hazardous pharmaceutical waste. So we are mainly concentrating on the hazardous pharmaceutical waste, as this needs to be controlled more strict than the non-hazardous waste. The hazardous pharmaceutical waste can be distinguished between the controlled substances, as well the anti-neoplastics, the anti-infective substances, and all the other hazardous waste. So when we have this sorting and classification system implemented in a health facilities, this will make the disposal and treatment later on much easier. Next one. So from the segregation, we have the storage. So here we have distinguished between the general storage requirements in routine processes, but also the storage and handling of large amount of pharmaceuticals during emergencies, for example. So here we have quite a bunch of case studies, as this is kind of happening during each and every emergency, that the pharmaceutical waste is piling up. So this is something we really would like to fight against, so that we really reduce the generation of waste also during emergencies by being better prepared. Next one. So from the storage, in case the waste needs to be disposed or treated externally in a centralized treatment facility, for example, we have the routine collection, so the use of external central safe treatment disposal facilities. We need a clear documentation, good packaging and labeling. And also something which I would like to highlight is to consider reverse logistics. So especially for small health facilities, it's very difficult to dispose and treat the generated pharmaceutical waste. And one good opportunity is to use the medical supply, so which is bringing medications to the facilities. And these transport means have the possibility to take the pharmaceutical waste back to the central warehouse, for example, or to the central treatment and disposal facility, so that we are really do not piling up any pharmaceutical waste in the health facilities. And then the other point is, besides the routine collection, is the transport of large amounts of hazardous pharmaceutical waste, where we need to consider the recommendations or the legal framework on the transport of dangerous goods on public roads. And also, in case it is exported to another country, in case there is no possibility to treat or dispose the waste, we need to consider the Basel Convention, or in Africa, the Bamako Convention. Next one. Okay, so here we have the treatment and disposal ladder. So, so there are a bunch of different possibilities to treat hazardous pharmaceutical waste, but there are better and not so good solutions. So the best solutions we have, so the optimal solutions which we should focus on, are the high temperature incineration with flue gas treatment, or the co-processing in, for example, a cement kiln, or the waste immobilization followed by disposal in an engineered landfill. So the different kinds of landfills I will just show you later on. So this is the optional options where we want to go to in future. Then we have the interim options, still high temperature incineration with no or limited flue gas treatment. Also medium temperature dual chamber incineration with auxiliary burners, or the burial on engineered landfills and immobilization disposal in controlled landfill. If these options are not available, so we are not going to worse open burning, for example, then we really look at storage possibilities. Why do we do that? Because we are not talking about infectious waste. So to store pharmaceutical waste for longer times is possible. So if we really want to dispose and treat the waste environmental friendly and proper, we need to consider the temporary storage with planning for removal and treatment off-site. And if this is also not possible, then we go to the immediate short-term response, but only in emergency situations, like encapsulation and disposal in uncontrolled landfill. So like you can see here, what is not recommended in this guidance, so this kind of new approach, is not recommended to use low or medium temperature incineration without auxiliary burners, or the burial in uncontrolled or controlled landfills. Next one. Yeah, so I will not go into detail, but this is quite important to understand when you read through the document. So we will also have kind of a ladder of landfills. So the best and optimal engineered sanitary landfill, like you find them in Europe, in the US, but also in some of the developed countries, and the emergency, also in emergencies. But then we have also the controlled landfills, which have less isolation of the waste from the environment. And then we have the uncontrolled landfills, like the dump site we find everywhere. So these are the categories of different kinds of landfills, and this is really outlined and defined in this document. Next one. Also, you might ask yourself, so what is immobilization? So this is not burning or really disposing the waste. It's really to use cement and lime and to immobilize the pharmaceutical ingredients in a solid block so that it cannot move to the environment anymore. And this cement block can then be disposed of in an engineered landfill, for example, so that it cannot get into the environment later on. So the further explanations of the different kinds of encapsulation and how to do that is all part of this document. Next one. We also have a decision tree. So starting with minimization and reduction of the waste, then the inventory and the possibility to return the waste to the manufacturer. And from there, if this is not possible, we go to the waste management part. So we segregate it into non-hazardous, hazardous, and hazardous controlled waste. And then we go through the different treatment options, the optimal treatment options, interim. If this is not possible, we go to the storage, the temporary storage, and maybe also to the emergency situation possibilities. Next one. So also here, this is a table which is outlining the different kinds of hazardous pharmaceutical waste and the treatment and disposal options. Here we are concentrating only on the optimal and interim solutions. So what is possible for which kind of waste? And in this table, you can really follow on the different possibilities and what is possible in your specific situation. Next one. This is also just a quick example of a glass crusher for vials. This has been developed by MSF, and it's a quite easy local manufactured possibility to crush empty vials and to dispose it directly into a glass pit. So there are also easy and possible and low-level options and possibilities outlined in the document. Next one. Okay, so here this is the list of different case studies we have. So from all over the country, from Nepal, Colombia, Canada, Indonesia, Netherlands, Yemen, Benin, Serbia, Haiti, Guinea, Oman, etc. So we have really a bunch of interesting case studies where we can see how countries have solved their problems with pharmaceutical waste. Next one. So the annex is quite also important because this is the first time we have really a drug classification, so a list of pharmaceuticals, and we classified these pharmaceuticals in non-hazardous, hazardous, and controlled waste, so that it is easier for the waste manager to segregate the waste. So then we have a waste registration template, safety operation procedures, also specifications for a hazardous waste incinerator in accordance to the Stockholm Convention, and a summary of relevant tools and guidances. Okay, next one. Yeah, so that's from me. I hope it was not too long. So the guide is, or the document, Safe Management of Pharmaceutical Waste from Health Facilities, Global Best Practices is available online. So you can scan it and download it. Yeah, thank you very much for listening. I hope it will be useful for your work in future. Thanks.
Great. Thank you so much for that insightful presentation. So now we're hoping to hear from some of our countries and other partners. And so I'm going to, let me stop sharing my screen. I'm wondering if our colleague Waltanji is on, and Quincy from Liberia. If you'd like to unmute. And I have a question for you. I'd love to hear your the implications of the recommendations in this document for your work, specifically in your country context. Um, are they online? Well, Tanji, I know he's in the field, so might be some connectivity issues. Up there you are. Thank you.
Yes. Thank you. Thank you very much. Let me start with the document in 1 minute and then share some what is happening in Ethiopia. From the document, I think in Dr. Rudi's presentation, and also I tried to scan the document, which is being shared before. There are important issues which is being raised in Ethiopian context, also in other African countries, most African countries context, especially when she was talking about the reverse logistics. That is, this document can guide um, uh, a lot. From the wash feeds implementation, there is, for example, for the incinerator, there is an experience of collecting to centers, because it's not possible to have in all elderly care facility proper incinerators. In some country, like in Uganda, they are trying to use to bring those wastes which need incineration to the uh, centers, and then collecting from different healthcare facilities, and also using a one center, one facility for number of healthcare facility. I think that is one of the options which can be adopted to country context from the document. And also the other thing is the treatment and the disposal ladders that can guide us in intercontextualizing to the country context. That ladder is very important. Maybe we can start with the small, the short term, and then go as we look for the improvement. The last one is the kind of the disposal methods, which is already listed based on the cost analysis, and also the standard of those kind of disposal. Countries can adapt depending on the resources they have available. And then the decision tree is also very important. In this document, these are which I found very important for the country to adopt into our context, because we have the like 8 or 9 center which has been supported by the global fund in the past in Ethiopian context. The operation and the maintenance of these centers for the pharmaceutical waste management is still a challenge. Maybe there is a chance of introducing how those healthcare facilities is going to pay, the pharmaceutical industry can pay, and they use this in a huge infrastructure which is built with the support of the global fund slash the World Bank. So this is how I can say this document, because we have used a number of WHO documents like the WASH feed, the water safety plan, the climate resilient document. Those are very important documents in adopting to the country context based on the resource available and the prioritizing, and then start implementation incrementally. So I hope this is going to be part of the wash feed. As part of the wash feed, wash and healthcare facility tool can help how we are going to manage the pharmaceutical waste in the wash feed context. I think for us, for the small healthcare facility, we are thinking of to implement the pharmaceutical waste management in the context of as part of the waste in the wash feed approach. But for the big industries and also a big chunk of logistic in the pharmaceutical, we are looking how we are going to put in place, ensure the sustainability for those existing infrastructure, which I have already said, around 9 to 8 infrastructure at different locations, location of the country, how to put in place the operation and the maintenance, and then running a cost so that we can use it properly. And then this document can help us to categorize those waste and then apply, contextualize, and use it as a guidance in developing our own context. I think I'm not going to do the PowerPoint, which I shared in October in Geneva. This is what I'm seeing based on the existing, what is happening in Ethiopia. This document we can work to adapt to the country context and then improve the existing pharmaceutical waste management. Thank you, and over.
Thank you so much for those insights. That's really helpful context to hear. I'm not seeing our colleague Quincy from Liberia, so I might ask a question to one of our other partners. Nada Hannah is joining us from the United Nations Environment Program. She's a pharmaceutical waste management and antimicrobial resistance expert. And I'd love to hear your reflections on the report and some of the opportunities that exist and biggest challenges in sort of implementing some of these recommendations.
Thank you, Ryan. Good morning, good afternoon, everyone. And thank you for this opportunity to be part of this webinar, and very pleasure to be with you. I think this report serves really as a valuable guide for countries in implementing safe pharma waste management in healthcare setting. It provides comprehensive recommendation for the sound management of pharmaceutical waste and highlighting a lot of opportunities, challenges, and also interesting case studies. At the end, we need effective national system for safe pharma waste and implementation, and we need to think what are the challenges for this implementation, what the opportunities can be adapted to the national context. And in this guidance and the report highlight a lot of challenges and opportunities. Some of these challenges, it's the limited awareness and training. We have really insufficient knowledge among healthcare worker and waste handler. We have resistance to adopting new waste management practices due to lack of incentives. Also, weak regulatory enforcement, inconsistent or absent national policies on pharmaceutical waste management, limited monitoring and compliance mechanism. Another challenge is the lack of infrastructure and resources, limited access to appropriate disposal facilities, especially in low resource setting, and high cost of implementing safe disposal technology. The other challenge is also the pharmaceutical waste volume and complexity, increasing the quantity of expire and use or hazard pharma, challenging also in the segregating different waste type for appropriate disposal. And environmental and health risk from poor disposal, this is another challenge. For example, opening, dumping, or burning of pharmaceutical waste leading to toxic emission, contaminated of the water sources. And also another challenge are the financial constraint with high cost of specialized waste disposal technology, limited government or donor funding for waste management program. However, we have also a lot of opportunities highlighted in this document. Some of these waste prevention, and waste prevention is the priority, is the best approach. And we can implement different measures to reduce the waste at the source or the generation of the waste. For example, we have a lot of initiatives can be taken, improve disease prevention through wash, clean water, hygiene, and also vaccination program, enhance responsible use of medicine through accurate diagnostic, reduce packaging size, promote a marketplace or a distribution. And we have example in the report about initiative called PharmaSwap in Netherlands, where they redistribute and reuse again the medicine which are unopened and with a good packaging and also unexpired. We need to build resilient healthcare system by ensuring effective management of emergencies, donated medicine, and substandard and falsified medicine, and also promote eco-labeling and smart packaging. Another opportunity are the regulatory compliance and standardization. We need to classify pharmaceutical by hazard for proper disposal and reduce disposal cost. And as it came in the report with the classification to non-hazard, hazard, or control hazard. And I can say with our experience with countries, Up to now, we don't classify pharmaceutical as a hazard, and this is a big problem because we don't include it in our regulation or our guidance and the national system. And also, we need to encourage national policies and legislation for pharmaceutical waste management with a clear rule and responsibility, and aligning healthcare facility with global best practices. Another also opportunity is raising awareness and capacity building, enhance knowledge and skill for healthcare staff and public, strengthening healthcare waste management system. And also up to now, we have very low awareness rate in most countries, especially in the low resource setting, and people, they don't know how to dispose in appropriate manner, and what the environment, what the health impact of this. So all this, we need clear messages, and we need really awareness campaign to reach this message about the pharmaceutical waste management. The treatment option also highlighted in this report in very nice and great manner, how to adopt innovation waste treatment solution or option, and based, of course, on the situation or context, from optimal, interim, immediate response in emergency situation, and which is give very much flexibility to the country based on their context to adopt those options. And also considering the cost saving and the resource optimization, waste minimization through improved inventory management, reduction of disposal cost through better segregation and recycling initiative. Another opportunities are sustainable public procurement, transparency and accountability. We need really database. We need to share data. We need data about the use, about the pharmaceutical waste, also about the measures happening and the actions happening at the healthcare facility at the national levels. And finally, stronger public-private partnership, engage healthcare facility, pharmaceutical company, waste management firm, and policymaker in sustainable waste management. And we need to encourage investment in wastewater treatment infrastructure. This is very much summary of the challenges and recommendations and opportunities came in this and highlighted in this report. Thank you.
Thank you so much for those insights. I know we have, I think, one more respondent. I don't know if Ruth Stringer is on from Healthcare Without Harm, if you'd be willing to offer a few insights on the value of non-burn technologies. There she is. Hi, Ruth.
Audio on as well. Thank you. I'm not going to make a long intervention. I think that Uta has given a very good overview of the report, and the last speaker also covered many of the different aspects of pharmaceutical waste management that really do need to be part of the overall solution. There is a limit to which, technical issues can deal with what sometimes is more of a resourcing issue, a logistic issue, a regulatory issue. But I think one of the things that's really important about the report is that it really does highlight the value of even the low-tech oxidation options of encapsulation and inertization to go alongside, and hopefully where there are no better solutions to replace the option for incineration. This can be done very simply where there are limited resources, simply to either take the pharmaceuticals out of the primary packaging and to put them into a block of concrete or into some sealing material in a container so it can be safely landfilled. It can also be done with the pharmaceuticals taken out of all of their packaging and then mixed with chemicals which will stabilize them, although that does involve more handling of chemicals and isn't necessarily the safest, because you do need to then protect your workers against the extra handling. Nevertheless, these are two options which can be really very helpful, and I think it's important that they've been elevated to one of the primary solutions and not put down at the bottom. But I'd also like to highlight a couple of other things that are in the report, just briefly. And those are the other ways that it could be possible to chemically denature the pharmaceuticals. Now, the last report from 1999 on disposing of pharmaceuticals in emergencies has been around for 25 years. And I think that this report, with all the additional thoughts and effort that's gone into it, is going to have a very long lifetime as well. But I hope that by the time that we come to the next one, we're going to have further options. There are hazardous waste treatment technologies that do not involve incineration that actually could be very effective for pharmaceuticals. One of them is supercritical water oxidation, which is using the water at high temperature and pressure so that it actually acts like an organic solvent, and it can sustain oxidation. So that can be used to break down pharmaceuticals without having to burn them. And then the other one is, I'm blanking on the other one. Isn't that ridiculous? This is the technology, alkaline hydrolysis is the word, sorry. And this is already in use for breaking down animal tissues. And so what it is using alkaline solution at, again, high temperature and sometimes a high pressure. And so this will, again, break down the organic chemicals that are present. And it is available in sizes from, big enough to take in entire animal carcasses to small benchtop units that are already in available for sort of doctors' rooms and laboratories and similar settings. The only gap is that these technologies have not been validated for use on chemicals, even though that, or they haven't been validated for use on pharmaceuticals, even though as a chemist, I can tell you that these are, we know that these are going to be effective. So that's my last thought, and my last hope is that we can make this step change, in the future and bring these technologies properly to market for pharmaceuticals so that we aren't, that we're able to move away from incineration in the longer term with the associated pollution and carbon footprint that entails. So I hope that that's a helpful insight. And Ryan, let me hand back to you. Thank you.
Great. Thank you so much, Ruth. So now we've got about 15 minutes remaining. We're going to turn it over to Q&A. So I see there's been quite an active chat, and we would love to triage some of these questions. I might, if Ute, if you don't mind, I know you've been answering a lot. I'm wondering if there's any quick statements you'd like to make on some of the questions you've responded to first before I pose any questions.
Yeah, maybe at least one thing what I really would like to highlight, because this is coming again and again. So when we talk about the treatment of pharmaceutical waste, microwaves and autoclaves are not possible to use for this kinds of waste. This is a no-go. So autoclaves and microwaves are for the treatment and decontamination of infectious waste, sharp waste, partly also pathological waste, but never ever for chemicals, pharmaceuticals, radioactive waste. So this is something I really would like to highlight again, because this is kind of, it's a rumor which is coming up again and again. So, so please consider these treatment technologies only for infectious and sharp waste. Thanks. So this is really important for me.
Great, thank you. And for everyone, please feel free to continue to post your questions in the chat. I'm wondering if there's another question here in terms of transition to more sustainable pharmaceutical products. How are we in terms of achieving this goal, which includes biodegradable pharmaceuticals? If you have any reactions on that.
excuse me, could you repeat? I was kind of reading the
Sure.
chat.
Yeah, no worries. In terms of a transition to more sustainable pharmaceutical products, how are we in terms of achieving this goal, which includes biodegradable pharmaceuticals?
Mhm. Far away from our target, I would say. But this is, when we talk about manufacturing, this is again a different topic. So we are really focusing in this document more on the health facilities and the waste generated there. But I really think that the manufacturer can do much more if it is requested by the user. And this is something which we need to consider because, for example, in these days, in the last years, more and more halogenated pharmaceuticals are coming on the market, which makes it again difficult for waste management. We always have to really see the whole chain from the manufacturing until the waste management. And this thinking is slowly coming into the heads, but it still takes time. But I think we are on the way. So hopefully, inshallah.
Great, thanks. Maggie, do you want to jump in?
Yeah, thanks, Ryan. No, just very quickly, I actually had two questions for two people in the audience. Also, just wanted to flag, and I saw some thumbs up that we do have a new WashFit course that has Ute's smart hands all over it on the healthcare waste module. So please have a look there. And we're working on an advanced healthcare waste course, which will address some of these more specific issues. No, I'm very curious to hear from Ed on the Guinea work about how they managed to mobilize disposing of 170 tons of pharma waste. And also, if there's time, I see Camila from Global Funds here, and I know they've made a lot of headroads in trying to address healthcare waste and pharmaceutical waste in particular. So over for me. Thanks, Ryan.
Hey, Ryan, can you hear me?
Yes.
Can everybody hear me? Great.
Yes, thanks.
Super. Thank you, Maggie. Ute, great job. Really enjoyed hearing from everybody. Ed Krasinas with WNW International. I've been in the healthcare waste sector now for over 35 years. Let me jump on to Maggie, your point question on Guinea. So this is post-Ebola crisis, and this was part of a USAID PEPFAR project to come in and help them with disposal of expired Ebola commodities. I would tell you the important thing here was that there was a plan. There's a way of attacking these areas throughout the country. And it's sort of, I'll use a medical term that I got from my wife, SBAR, situation, background, assessment, recommendation. So the first thing is you were very focused on what you needed to do. And as in an A&E or in an ER, you've got to triage a facility. You've got to see, what do we have? I did an initial assessment, and I saw the areas where pharmaceuticals are being stored, where Ebola commodities are being stored as well. Veolia came in and was hired to actually do a countrywide assessment. They hired pharmacists, they hired local people, they trained them. I think this to Marco's point of, yes, this can be really challenging when you're dealing with large volumes of waste. And 170 tons was big. And there was PAJ was another group that did the same thing in Haiti. So it can be done on a large scale. It's a massive undertaking, but you had a very defined scope of work. You identified the drugs, trained people, there was oversight. And it took several months to get this completed, but shipping containers were filled in major collection points or storage areas. Ute made a point before about reverse logistics. So many countries in Africa and other parts of the world, larger ones, certainly have a distribution system for getting drugs out. I did this with colleagues from SCMS back in Tanzania, going throughout the country, and we saw the MSD vehicles going back and forth, empty, coming back. Well, you can bring this stuff back to Dar es Salaam. Not a lot of great incinerators. Some of the chats here talking about the issues with incinerators, but this was a very well-designed, thought-out program. So you really had an idea of what you're doing going in. And this is also engaging local people. And I think the combination of, in fact, remember, Francophone country as well. So there were some additional challenges in communications, but Veolia worked very well. It was a very successful program. The drugs were sent back to Bordeaux, in fact, or the waste was sent back to Bordeaux for incineration. So that was the key part, Maggie. And Ethiopia, again, our colleague from Ethiopia, Katane, I know, I mean, I've done a lot of work there. I know that they were supposed to have a system of incinerators. I commented in the chat, and this will be my last comment here, is I think the most critical part, if you are going to be burning waste here, you really have to understand how to feed these incinerators with these waste streams, because you have cardboard, you've got glass, you've got liquids, you've got semi-solids. You need, if you're doing a commissioning of a new incinerator, the commissioning agent or the vendor cannot spend just a few days and say you're good. They really need to spend probably a few weeks with you, I would say, as compared to if you're training somebody on infectious waste incineration. So I think there's a lot of things that I'm excited to see that this text is out there. I think we need more case studies. There's some great questions coming up in the chat. Again, Ute knows if somebody's got a question, and Ute, they come to you, you share my email for sure. I'm happy to help you out. My team, Boba from Bosnia, Victor from Macedonia, I think he's on the call. We've had a lot of experience specifically with guanidine thiocyanate management. So we've come up with very low-end ways of dealing with it to higher ends, which is exactly what we came up with this pharmaceutical document. Thank you. Over.
Thanks, Ed, for that insight. Really appreciate it. Camilla, did you want to jump in?
Yeah, sure. Thank you, Ryan. Thank you, Meg, as well. So first, congratulations for this work done with this guideline. And talking from Global Fund perspective, the document is very useful as a whole, especially the treatment and disposal part has been the most useful in the past year for Global Fund. So to provide a bit of background, the primary focus of Global Fund's investment is to provide waste treatment technology to countries that currently adopt non-compliant or unsafe waste disposal practices. So we have a centralized technical assistant called Mott McDonald, who provides support to 21 countries across Global Fund's portfolio. And so Global Fund, through this TA, is advocating for high temperature incinerator that is compliant to WHO guidelines, and that includes dual chamber treatment with flue gas treatment to minimize emissions. So even before this guideline was launched, we used the draft guideline to inform the technology selection. And we also collaborated with UNICEF and Gavi to include inputs in our joint waste management workshop that happened last year by end of 2024. So in general, the guideline has been a reference for us. And I think in terms of opportunities, we see that countries lack funds and capacity to sustainably operate and maintain the systems. So for sure, there is opportunity there in how making the systems operable, sustainable, operative. And this means understanding costs, funding sources, and also defining cost recovery models. And for sure, there is also opportunity for continuous collaboration. And yeah, so basically that's what I'd like to share for today. Thank you.
Great, thank you so much. Are there any other questions? Ute, I don't know if there's, I know I've seen you respond to a bunch more questions, if there's anything you want to particularly point out.
Well, I'm just answering the one on cancer treatment, so the cytotoxics, the antineoplastics. So also this is falls under the hazardous pharmaceutical waste, and this is actually also mentioned in the document, and all the different treatment possibilities are outlined here. So which is including the high temperature incineration with flue gas treatment, co-processing, encapsulation, followed by disposal in an engineered landfill, and also the chemical decomposition and disposal. So it's this kind of pharmaceutical waste is really highly hazardous and needs to be treated and disposed of really safely. So there interim and emergency solutions are not really recommended for this kinds of waste, as it's really very hazardous and is very risky to get in touch with.
Thank you. Brian, do you want to ask your question?
Yes, thank you very much, Ryan. I'm Brian. I'm with Engineers Without Borders East Africa. I think from the Ugandan experience, we have conducted a range of assessments across the country using the WashFit tool. And currently, a lot of our work has focused on capacity based on what we discovered is there are facilities that do have the technology in place, but it's probably not being used as effectively as it should. So I think I've also had there are people in this meeting who are interested in collaborating and on piloting some of these technologies. I think those are discussions we'd be very interested in, especially for the Ugandan contexts. Yes, thank you very much.
Thanks for that. Do we have any other questions? Maybe time for one more quick one. All right. Well, thank you all for such a lively webinar. This has been really exciting to see. Please, I know there's been a call for lots of case studies. If you have additional case studies that you'd be interested in sharing and talking about, please feel free to email me. We would love to put together more sessions on healthcare waste management. And we love lively discussions. We love when these webinars are very engaging and through the chat and through participant engagement. So thank you so much. Thanks again to Ute and all of our panelists who offer their insights. We will be posting this webinar to the YouTube channel shortly once it's downloaded, and we'll also include some summaries from the session, and please be sure to check out the report. You'll see all of this information shared in the upcoming newsletter. So thanks all for joining. Please have a great rest of your day, and thanks again for your participation. Take care.
Thank you. Bye.
Thank
Bye.
you. Bye-bye. Thanks.
Thank